Good evening, everyone, and welcome to the Revere School Committee's Committee of the Whole meeting. We are on Zoom this evening due to some construction that's happening in our school committee room and some upgrades that are happening. So we did have to switch to our online format. We will be online for both the 5 o'clock and 6 o'clock school committee meeting. We will begin with a roll call of the members.
Mrs. Bronson Rizzo.
Here.
Mr. Ferranti. Miss Grabellisi.
Here.
Oh, Mr. Ferranti.
I'm here.
Mr. Kingston.
Here.
Mrs. Milbury Ellis. Mrs. Milbury Ellis.
Here. Sorry, I'm having technical difficulties.
No worries. Miss Ty. Oh, I see Miss Ty. I'm going to admit her.
Carol, can you turn on your audio and just say here?
Miss Ty, are you able to hear us? All right.
Why don't we move on?
Yeah. Mayor Rigo.
Here.
Okay.
Okay. We will begin with the consent calendar and the approval of minutes.
Can I make a motion to go out of order and take item number 2 on the DESE mask mandate so we can get that information from Dr. Kong and Lauren so we don't hold them up?
Okay. Motion by Mrs. Rizzo to go
Second.
out of order, seconded by Mr. Ferranti. Roll call.
Mrs. Bronson Rizzo.
Yes.
Mr. Ferranti.
Yes.
Mrs. Grabellisi.
Yes.
Mr. Kingston.
Yes.
Mrs. Milbury Ellis.
Yes.
Miss Ty.
Yeah.
Mayor Rigo.
Yes. Okay, we will begin with item number 2 on the agenda, which is the DESE mask mandate and a presentation by Dr. Kong and Lauren Buck.
I'm going to share my screen. Lauren, I'll share the screen. Do you want to go over the memo? Okay. Can everyone see the PDF?
All right. Everyone good? Okay. So Dr. Kong and I worked together to create a memo. Can you mute yourself, Dr. Kong? Okay. We worked together to create a memo to create a framework for how to think about masking in kind of the post-Omicron surge in light of what we all know from DESE, which is on the 28th, the DESE mask mandate is ending. And so how do we inform what happens in Revere Public Schools after that time? And we combined our knowledge of what has been going on for the last couple of years and what other communities are doing and some data tracking methods that have been used throughout the course of the pandemic. And we came up with a measurement that has actually been around for quite a long time that is a graph that kind of puts puts where we are in our community into two categories that you can use to determine if masks mandate need to continue, if mask mandates need to be re-implemented, if mask mandates need to be discontinued. So as this memo mentions, in light of the changing protocols and the new insights into the COVID-19 pandemic, the Revere Public Health Department is recommending using the following criteria to inform decisions regarding the continuance or removal of the current mask mandate that is in place in Revere Public School buildings and the City of Revere municipal buildings. These recommendations can also, though, be used when determining if mask mandates need to be re-implemented and then potentially discontinued in the future. So what you're looking at here is a graph that comes right from the CDC's website. This graph is used as a determining method for community transmission. There are two community transmission level indicators that are shown on this graph. The first one is the total new cases per 100,000 residents in the past 7 days. I'm going to call this incidence rate. The second is the percentage of NAATs that are positive during the past 7 days. This is what I'm going to call positivity rate. NAATs is roughly equivalent to PCR methodology. So this is a really good guide to determine how at risk our community is in terms of their community transmission levels. As you can see, there's 4 categories. There's the low transmission, which is blue. There's moderate, which is yellow, substantial, which is orange, and high, which is red. We are recommending that the school committee uses this guidance in terms of when mask mandates can come on and potentially in the future when they can come back off. As you can see, we've basically divided this into 2 categories. Low and moderate transmission are classified as masking can come off, the mask mandate can be discontinued. Substantial and high transmission categories, masking needs to be either continued or re-implemented. We are recommending that both community transmission level indicators, so both the top row, which is the incident rate, and the bottom row, which is the positivity rate, need to be in a specific category for 2 weeks before adjustments can be made. This isn't arbitrary. This is these designations are recommended by the CDC in terms of masking and not masking, and are also used by many other communities in terms of trying to use formal data-driven guidance for mask mandates in whatever arena that they're talking about, whether it be schools, municipal buildings, restaurants, all that stuff. So this is pretty validated guidance in terms of using data to make informed decisions. So we can talk a little bit, if you all have questions about kind of where Revere has fallen into these categories over the last couple of weeks, where we are currently. But I first want to pause and just have Dr. Kong jump in if there's anything that I missed.
Nothing that I don't have anything to add to that. That was great. Do you want to go over the second half, or do you want to stop now for questions? Okay, second half.
Okay, so as Dr. Kong mentioned, the first graph that I gave you does not take into consider vaccination status when you're using the chart. This second graph is takes into account vaccination status as a way to have, obviously, when we think about COVID prevention methods, we think about the Swiss cheese effect, and we think about how there's layers and layers and layers of protection. The first graph doesn't take that into account, and you can make the decision based on masking regardless of vaccination status. This graph takes into account the vaccination status of a specific population. In which case you can kind of move the meter a little bit more towards the higher substantial transmission, because we know that we have such protection in terms of vaccination status. So we are recommending that if you want to use this chart, which again moves the determining factor from moderate, between moderate and substantial transmission to substantial and high, that the population that you're looking at, which in this case would be Revere Public Schools, needs to be at 70% fully vaccinated, We are considering fully vaccinated as 2 doses of the mRNA vaccines and 1 dose of the Johnson & Johnson vaccine. And at this point, not considering the booster in that calculation. But if a certain population, whether it be a school, whether it be a district, whether it be a city, is at 70% vaccination rate, then you can move the mask mandate barometer a little bit higher up into the substantial category, because we think that there's a protective level of a substantial and enough people being fully vaccinated. So again, the difference between this chart that we showed you and the one that I just talked about is this chart takes into account vaccination status. Vaccination status being, we are determining that 70% of the population needs to be fully vaccinated in order for us to move the barometer up 1 category. And I'll pause there again to see if Dr. Kong wants to jump in.
Yeah, and that population is going to be different for different scenarios. So in this meeting, your population will be the Revere Public School teachers and staff, right? Folks that will be interacting in a defined space for, long periods of time, sometimes close with each other. This can also be applied in municipal buildings, or at least in City Hall, where we have data to show how many folks in City Hall are vaccinated. So it's not, all that to say is that we're not taking the whole city as like the number to consider when you can move this barometer up, just the population you're kind of talking about when it comes to whether you put masks on, you take them off, or put them back on again. So I just wanted to make that distinction.
Can I ask a clarifying question on that, Dr. Kong?
Absolutely.
I think if I heard you right, I thought you said teachers and staff. Did you mean staff and students?
Oh, staff and students, yeah.
Okay.
Thank you.
So we're happy to
Lauren, before you go, I just want to recognize Mrs. Rizzo.
Oh, my apologies. Diane just clarified that.
Okay.
I was thinking students also. So I
Okay,
was
sorry about that.
hand down.
There's a
Lauren.
couple of, okay, sorry, thank you, Mayor. There's a couple of things I want to talk to you all about where this data comes from and how it's collected. That would also potentially be useful knowledge for you all. As a Board of Health, we get updated on positivity data weekly from the state. This data is conferred into our regular data calculations that appear on revere.org, but also can be communicated regularly with you all when you're trying to make the decisions if you decide to implement this kind of procedure. One clarifying point that I want to make that Dr. Kong and I have discussed already. If you look closely at this graph, the second community transmission level determination marker is the percentage of NAAT, I'm going to call them PCR testing. So the positivity rate for the past 7 days. The state of Massachusetts gives me and the Board of Health positivity data over the last 14 days. So, okay. So it is a slightly different calculation, but we don't think that it changes the data significantly enough for this chart to not be useful in our determination, in the determination of mask mandates. So I just want to make one point that we receive data that shows positivity over the last 14 days instead of the last 7 days. We don't believe that changes the data enough for this graph not to be useful and effective in terms of the numbers that we're seeing. So that's just one clarifying point I want to make. The second clarifying point to make, and again, just a reminder, the positivity data we get on a weekly basis. We usually get it on Thursdays, Wednesday nights, or Thursdays. The first indicator, the incidence rate, which is the total new cases per 100,000, that is a rolling number. Right? So that is data that is used for the past 7 days. So you can imagine that data is updated daily, right? Because you're always looking at the last 7 days. So, and I can let Dr. Kong speak about this, but the data is collected in slightly different ways, but is still useful in terms of it's still manageable in terms of what we can do when using this chart. That's just 2 clarifying points I wanted to make about the data.
Yeah, and I think what is also helpful to note is that in this box here, and you can see it for both graphs, whether you're considering vaccine status or not, both of these levels that Lauren talked about must be in either the orange or red for 2 consecutive weeks in order to put masks back on, and both must be in either the blue or yellow to take them back off. And it should be for 2 consecutive weeks. And I think that can help to sort of average out some of, especially the daily counts that we get. But it also, I think, helps to mitigate against the flip and flop too much. So like 1 week we're, jumping the gun and putting masks back on, another week we're taking them back off. So it's seeing the stability is also equally important so that we're not quick to put them back on, nor are we too quick to take them off. So that's just another piece I wanted to flag there.
Do any members have any questions or comments? Ms. Milbury Ellis.
Thank you for that. It's good to see some type of a plan here. I have to say that I think I'm like most people where we've just kind of been going along and deferring to the experts in this because you and the CDC knows best, right, as to what's best for us. And so, we're wearing our masks religiously. And I have to be honest, up until last week when I started to actually read what's on the CDC's website and inquire a little deeply, that some concerns have been raised. So I'm hoping that maybe you can educate me on this to kind of shed some light on this for me. So what I found is as I'm reading the CDC's website is, one, there's no real guidance, updated guidance coming from the CDC as far as, an end game, some type of off ramp as we transition from a pandemic into an endemic. There's a blanketed statement that we need to wear these masks in schools without really any explanation as to why, what's the benefit, what's the source of this information, right? So now I'm intrigued. So the nerdy side of me got the best of me, and I'm going in and I'm reading the science. Trust the science, Aisha. And the science comes down to a study that was conducted in Arizona on 2 counties in Arizona. Arizona starts school in July. So the survey was conducted between July and August. And it had found that, of the school districts that had mask mandates, there were 16 out of like 210 outbreaks. Of the ones that didn't have mask mandates, there was like 113 out of 480 or something like that outbreaks. And so based on these figures, we get that schools without mask mandates are 3 times more likely to have outbreaks. That's the science. And I got to say, I can't believe the words I'm saying tonight, because I've always been one to defer and abide and do what you're told and do what's right. Nobody wants to get anyone sick. But I'm curious as to what your thoughts are based on your experience and your own education and your research as far as how beneficial are these masks, are wearing the masks. I mean, from what I could find, it's very low on the totem pole of mitigating circumstances, and compare that to the unknown long-term effects that it may have on these kids physically, emotionally, socially, not being able to read faces, not being able to learn social cues. I mean, we talk about social emotional learning and pride ourselves on that. And number one in that theory is being able to read expressions. These are just, I'm sorry to, regurge all of this, but since last week, I've kind of just been like, this has all been in my head. Like, what does all this mean? If these masks aren't working the way we all believed they were as we wore them religiously, then we need to really consider that and consider the information that's truly available to us, and maybe not wait for the CDC to get off their butt and give us some real guidance.
Yeah. Thanks, Aisha, for that question. I 100% can relate to some of the frustrations, or at least, not having a clear path forward or picture forward. I will say, in thinking back to 2020, March 2020, we've definitely gained a lot of insight in that 2 years. but that doesn't mean we finished learning about this virus. That doesn't mean this virus is going to continue to change and give us more about it to learn about. But I think we've come far enough to make some pretty good balanced decisions about taking them off versus keeping them on. A couple of comments I want to make. The CDC, I think I want to make sure everyone knows this, but I think it's useful to say they're an entity that must guide the entire nation. And we've seen waves of spread in Omicron where it started with us. Where we were in a month ago is probably where California still is now. So just remember where we were a month ago and how many kids were out. That's what some parts of the country are still experiencing. So CDC needs to blanket themselves for the whole country. But that doesn't mean that local mask mandates have to stay as strict as what the CDC is offering. That doesn't mean we have to take our numbers, which thankfully are going in the right direction, and continue to operate in the same way California is now, right? We can make some decisions in our local community because, for better or for worse, what's happening in California now, thankfully our kids aren't experiencing it now. We've been through that already. We've paid our dues. So that's part of the reason why Lauren and I kind of went back to the data, conferred with some of the experts to create a roadmap. How can we continue to use the science and honor the science, but also recognize that we are in a much different place and arguably a much better place than we were in March 2020. So hopefully this gives a bit of a clear cut, as clear cut as you can make COVID, a clear cut avenue for when to remove masks and when to put them back on. One more comment I'd like to make is it's never going to be one thing that defeats COVID. It's all about layers of protection. So the mask can offer one layer, social distancing can offer another, ventilation's another, vaccines are another. You always layer these approaches. And now that we have a better understanding of COVID, how it works, now that we have vaccines widely available, now that we have even treatments widely available, and access to both PCR tests, but also the rapid tests, that is changing, I think, what I'm going to call our risk tolerance, okay? And risk tolerance goes back to those colors in that graph that Lauren went over, right? From the low risk being in the blue to the medium-ish being in the yellow and orange and then the red risk, right? If we have these layers of protection, maybe you and I will get on a plane and go on vacation to Florida, right? Because we're going to have our mask, we're vaccinated, we're going to tolerate that risk of that airplane. The question now is, what kind of risk are we willing to tolerate for our children and for our teachers? That has to do everything to do with what we're seeing locally. Remember, California is in a different place than us, but thankfully we're in a better place. So look at the numbers locally. Let's look at what Lauren talked about, the case positivity rates, the incidence rates. Let's use that to decide when can we take these masks off, but recognize that if you want to keep them on to continue to lower your risk, you can. Recognize that something else that's helping us decide our risk tolerance is the fact that we can be fully vaccinated and boosted, right? I'm fully vaccinated and boosted. I feel comfortable, putting my own self at risk to be on a plane. What am I willing to force other people to do in terms of their risk tolerance? Because remember, I don't have to go to school, right? Like I've done that already, and I don't have to go on a plane either, but I know that I'm not going to really impact anyone but myself. And then the last thing I'll say is, actually, I'm gonna skip that. I kind of already made that point. Never mind. That's all I'm gonna say. Lauren, do you have anything else to add?
I think I'll just make a point that I think over this school year, that couple of things. One is I think we've proven that schools have done a really great job in terms of mitigating risk, in terms of mitigating COVID risk for our students. We know that they need to be, that are the best place for our students is in schools. And this school year has really proven that the measures that we put in place has made it as safe of a place as we are capable of making it. One of the huge things that made it that safe is regular, consistent masking. And so that doesn't mean that masks need to stay on for for an indeterminate future. We also recognize that we do have to start living with the endemic nature of this versus the pandemic nature of that. We all understand that. But I think in terms of safety protocols, masking is pretty effective in terms of, in terms of a layered approach. We know now that, I don't know if you remember, but, there was a time period when we were wiping down groceries and disinfecting surfaces. And we know now that that's really not the type of spread that you get. There are things that we've learned, and I think masking has been proven to be a pretty effective mitigation measure. And then the last thing I'll say is that, at least in the very, none of us can predict the future, but one of the things that potentially is not going to change drastically for at least this school year is the fact that if someone does have COVID, they will have to isolate, right? And that we know how disruptive that is to everyone. We know how that disruptive it is to students, to family members, to entire, classrooms, to teachers, to everyone. The isolation component of COVID mitigation is not going to go away for this school year. And because of how disruptive that is, we want to minimize the number of people who have to isolate because they potentially are potentially infected with COVID. And so although we are moving in a more endemic situation, that component of the disruptiveness of COVID, we want to try to minimize that as much as possible. And to do that, you take a lesser disruptive approach, which is potentially, masking to help make sure that we don't have kids continuously out for 5 days, that kind of thing. So those are the last 2 points that I'll just make.
Yeah, that's actually a really good point that you made, Lauren, is that if someone is exposed to someone who got tested for COVID, the definitions still say that if you are unmasked, right, then you are considered a close contact, and there may be steps that need to be taken place to make sure that child is either tested or maybe needs to isolate or quarantine. So just something to consider.
Mr. Ferranti?
Thank you, Mr. Chairman. I have a question either for Diane or Lauren or Dr. Khan. Where does the city in the school department stand right now with the vaccination rate? Are we above the 70%? Let's put it that way.
I believe our municipal workers are above 70%. I don't know about schools, I think.
Diane, do we have that information?
We have not, we have information on staff, but we don't have information on all staff, and we do not have information on students. So we would need to collect that information in order to determine where we stand in terms of the vaccination rate. I know the numbers at the city level, and Lauren probably knows them better than I do, are fairly high. I'll let you talk about that, Lauren, because you know them exactly.
Yeah. This is a really good question, right? And I think Dr. Gallucci and I know better than anyone, determining vaccination rates at a school level is a little bit of an intricate dance. It's not something that we get age group data at a city level, but remember that an age group level finding takes into consideration people who don't go to Revere Public Schools, people who go outside of our district. I can say we have a general average from the age groups that are currently eligible for the vaccine. That's 5 to like the 19-ish range, is about at 63% fully vaccinated. That's every 5 to 19-year-old in the city of Revere, and not specific to Revere Public School students. I think we can infer some things from that number, but it's not specific for Revere Public Schools.
And Lauren, these numbers are for either 2 mRNAs or 1 Johnson & Johnson. That's what's defined as fully. Okay, because the other assumption we're making is, not assumption, but something that's an inherent flaw in what we're doing is that we're saying that's completely vaccinated when we know there is a booster out there that's effective. We haven't taken that into account to just recognize that what we're presenting to you, none of the booster rates are there, and the booster rates are likely to be a little bit lower.
And I will just put one bit of nuance on that data. We know that the rates are significantly higher with older students than they are with younger students. So when you disaggregate those numbers out, I believe, Lauren, the high school numbers are closer to 80%. Sorry, no. Was it 90% with 1 shot and 78% with fully vaccinated at the high school level?
I mean, I have the data here. Do you want me to just share my screen?
Sure, that'd be great. I'm like, I was
Yeah.
just gonna pull it up
right,
myself. I
yes.
know Lauren sent it last week.
Yeah, and again, keeping in mind,
This is for the entire city. Again, not just for Revere Public Schools, and you can see there's even older age ranges here.
right, so this data shows that that Dr. Kelly is exactly right. First of all, 5 to 11-year-olds have only been eligible for a vaccine for a much shorter amount of time than any other age group. And our 12 to 19-year-olds are hitting that 70% mark that we have talked about at the city level. And the 5 to 11-year-olds are growing slowly. I can tell you the rate of change for the 5 to 11-year-olds. Again, this is a weekly-ish data that we get. Last week we were in the 26, 28 range. So it's gradually, increasing. But the rate of change is a little bit slower than we've seen in other age groups.
So
just
with,
finish
go
No,
ahead.
go ahead, go ahead.
I was just gonna ask one more question around the community when we're talking about what is the community. So we would not be able to go by that data. We would have to request that parents and staff submit their own affidavit for each child on whether or not they're vaccinated, correct?
Yeah, so again, this is a bit of the intricate dance that I was talking to you about, that Dr. Galucci and I, there's a couple of different ways that, first of all, I just want to separate. Staff data is a little bit easier to come by than student data. Student data, okay, so staff data is a little bit easier and different to come by than student data, but student data, there's a couple of ways you can come at it. You could request a portal, essentially a submission portal that parents would have to upload a vaccine card. There is a state database that all this data is pulled from that you can look into. It's quite hard to extrapolate based on a school population level that data. You can imagine that there are, if one letter is off, if two last names, only one last name is used in one data and another last name is used in another data set, it can be really hard to mesh those two together. Then there's other reporting mechanisms that there's different ways to get at the school data, but any of them are inherently a little bit flawed. And we know that with all data, right? I mean, all data is inherently flawed, but I'd say probably the most straightforward way to go about it would be what Dr. Kelly is proposing, which would be somewhat like a portal upload self-attestation way to go about it.
Ms. Scrivelisi and then Ms. Milbury Ellis. Sorry.
Thank you, Mayor Arrigo. Could you tell us what our current cases are per 100,000 and our 7-day positivity rate? I know it's on the website every week and it's updated every Wednesday or Thursday. Not everybody that views actually even knows or checks on that, and what it is now and what it's been trending. I know it's going in a great direction. So if you could update everyone on that, would be great.
Yep. I'm going to let Dr. Kong share her screen. So we kind of pulled the data and tried to color code it to help put it into the categories that you all saw on the other chart. And we can start with, this is the data of kind of the second indicator in the chart, which is our positivity data. This is where we are right now. So you can see that for many, many weeks in the school year, we were actually falling into that low transmission category. And then this kind of, if you think of it as kind of a wave, we started going up around in December. We went from low to moderate to severe to high, which is currently where we are right now. The latest data that I pulled from this morning, which was February 10th, showed us a 2.1, which is just in that high category. If you can see here that you can see from kind of our peak at 34.4%, which was back in January 13th, we are coming down a downhill trajectory. I mean, very, very steeply, which is really, really good news. And I think there's no reason for us to anticipate right now that that downward slope is going to slow down. I think it will continue to decrease, which will hopefully put us in that yellow or blue category quite soon, hopefully. But right now, this is our trend for positivity rate. And we can go to the next graph. Yeah, Dr. Kong, and again, shows you the difference in data here, because this is a daily count, right? Not a weekly count. So if you actually scroll back up to, can you go back to kind of put us where we were maybe in December, November, December. So at the very top of your screen, you're seeing a hint of yellow there, and that we knew this was the Thanksgiving holidays. This was the peak, not the peak, the start of the Omicron wave here. And so we were still in that yellow category. And then we hit the next category, substantial transmission in the orange. And that was in late December. Mid-December, sorry. And then late December, January is when this is kind of the peak of the surge here. And that was the high transmission, wave, kind of, this is the peak of the Omicron surge. And we've actually already trended down in this data point, which is really, really good news. And that's where we expect the positivity rate to continue to go. We are actually already in moderate transmission for this data point, which is, and we've been there, as you can see, since February 2nd, which is a really good trend. It means that that we haven't been fluctuating up and down. We have continued to stay in the moderate transmission range, which again, that falls into the masks off category. If we can get both of these two indicators in that range for 2 weeks, that is the marker in terms of potentially removing that mask mandate. So both numbers are trending in the right direction, but this is where we currently stand in terms of our data.
Ms. Milbury-Ellis.
So this might be a silly question, and in no way am I trying to incite whatsoever. I just really am trying to gain an understanding. So forgive me. My question is, how do we know, we're here to talk about the mask mandate and to figure out what we're going to do. How do we know that masks are working? I know you've said it's been effective, and I know that there's this layered effect of mitigating factors that we're taking, but what metrics are you using to substantiate that statement, or the experts? What metrics, what are they using to substantiate that the masks are working and that they're substantially effective?
So I can talk a little bit about this, and I think actually I don't want to put Dr. Gallucci on the spot, but we worked really closely about kind of the protocols that were in place and how we can tell that schools are safe. One of the biggest kind of one of the biggest indicators that you're trying to determine is if there's in-school transmission, right? And that kind of knowledge about if there's in-school transmission, that shows if a school environment is safe, if a school environment is safe. Think about all the different ways of transmission, right? There's in-home transmission where, it's within a family. There's transmission within a hospital setting. Well, we're wondering if in-school transmission is happening. And one of the ways that we know that the schools have been so safe is because, remember, we started the school year with a protocol where we were identifying close contacts of someone who was in a school setting who was COVID positive, testing those students or staff members for the next 7 days, and determining if they potentially, if there was transmission within a school setting, and if they potentially converted to positive themselves, right? And from that wealth of data, we found that in-school transmission was negligible. So that is one of the biggest indicators to me that shows that the measures that we put in place reduces in-school transmission. There's no way we can reduce transmission outside of the school setting, in a home, right? But we can mitigate risks while we're in a school environment. And because we saw such low conversions in our test and stay protocol, we know that the protocols that we had in place were reducing transmission.
I also want to add that the same goes for hospital settings too. A lot of the infections that occur among healthcare workers tended to happen outside of the workplace because mask mandates, even after any mask mandate changes, healthcare or hospital systems are still required to wear masks. So because of that strict kind of protocol we have, we found that people were more protective at work than they were elsewhere. And that was one of the reasons. And these were studies all done before, before, during, and throughout the vaccines, right? We had this data before vaccines. We still continue to collect this data even post-vaccine availability. So those are some reassuring data points that we have that tell us that this is one effective, layered protective approach that we can take.
But it really hasn't been siphoned out to be able to say how effective the masks are versus ventilation and vaccines. Am I correct? It's just kind of like a general approach that, okay, these measures are working, but we really don't know whether how efficient the masks are, right? We don't know. Do we have that data? I'm asking because I really don't know, and I've been looking for it because I feel as though we're talking about a mask mandate, and we can have the numbers are going to be what they're going to be, right? But if something's in place that isn't, we're not getting a substantial benefit from. I understand you're saying that we are collectively with these other mitigating factors, but if we're just parceling the masks out, and that's what we're talking about, I'm just trying to get a better idea as to how effective these masks are, not taking into account the other mitigating factors. Does that make sense? Are there studies out there where they just looked at the usage of the masks?
I'm sure there are a lot of different types of masks. We know N95 masks work really well. Like there are studies about that. That's why we use them in the hospital to treat, especially if we're seeing someone with TB or something. So we know, I think there are studies out there about N95 masks. I'm not aware of, at least I haven't seen any data. I'm sure there are. I can definitely perhaps get back to you and maybe consult with some infectious disease experts if they know of any, but I can't think of anything off the top of my head right now, and I don't want to mislead you or anyone else in this meeting right now.
Yeah, that's fair. That's fair enough. I just want to have all the information available. I just think I know that I have been, going along and doing what we're supposed to do because that's the right thing to do, right? But I'm just kind of questioning it a little bit closely now that I see that we're really not getting the detailed guidance that I would have expected was available, through the CDC until I just looked myself. And so it's like, if they're not giving us this guidance and we need to make these decisions, then we should really look at what they're basing their decisions on. I just want to feel like the science is solid. I want to know that the masks are working. And if I had that in front of me, I feel like I could, I want to be able to make a case either way based on the information available, if that makes sense, whatever it may be.
So maybe, I just want to mention that we've done 4 webinars now for parents with colleagues, both of Natalie's and some friends that we found in the COVID groups that Richie and I are part of. But we've done 4 seminars for families with infectious disease experts. And every time they've said to us, the mask is the key. But we can certainly circle back to them and see if something has changed. The last one we did, I think, was in January, Nat, is that right? Yeah. But we can see if something has changed since then, but they were unanimous in saying how effective the masks were.
Did any other members have questions or comments? I thought I saw Mr. Franti's hand, but no.
just have, Mr. Chairman, I just have one question. Based on the data that you gave us, is the Board of Health recommending that we eliminate the mask on February 28th? I know it's a tough thing to say, but it's sort of like, you sort of got to project it out a little bit. Is that the recommendation or not?
So the recommendation is to follow the numbers right now, because the numbers are what's going to tell us what type of risk level we're at as a community. So if after February 28th, we hit the blue or yellow category that we had indicated in that graph, and if we are in those areas, those lower risk levels for 2 consecutive weeks on both the incidence and positivity rates, then we can say confidently that we can at least make masks optional, right? At least make masks optional. I think masks are always going to be something that anyone can put on, especially those who are immunocompromised. I'll tell you, I think Mass DPH just came out with an advisory saying that folks who are immunocompromised or live with someone who's immunocompromised should continue to wear masks indoors. And that's always going to be a personal decision that anyone can make. But in terms of making it like a requirement, you know, this is the kind of plan we've come up with to help us guide whether we're in a lower risk category and we can probably safely remove them. But remember, it's also going to guide us if we ever find ourselves, and I really hope this is not the case, but if we ever find ourselves with another Omicron or another variant that spikes our numbers up in the levels we just saw a month ago, it'll at least tell us and guide us that, hey, like, we're not going in the right direction. We should probably put the masks on, because we're hitting the orange and red zone again for 2, 3, 4 weeks. So it'll tell us it'll give us a little bit more freedom in that way, I think. And that's kind of, I think, the best way to, I think that's the best approach we can offer right now, is to follow the numbers and kind of let that guide us and not kind of pigeonhole ourselves into a more like a black or white yes or no situation, and just kind of maybe be fluid with the science and with the evolving nature of this pandemic or endemic, whatever it gets called. I hope that answers your question. I kind of hedged it a bit.
Yeah, but the problem we're going to have is that the kids go on vacation next week, and then, you know, almost anything is possible depending on where people are going, and that could inadvertently drive the numbers up, which means it would be another issue. You know, what we're going to do, because everybody's expecting that the 28th, they're all coming off one way or the other. So it could be another issue. So it's really going to be hard to determine what happens when the kids come back from vacation.
You're absolutely right. And that's one of remember that one of the guiding principles here is that we have to see numbers in a low or moderate transmission level for 2 weeks, right? So we're almost 2 weeks. We're almost 2 weeks from that 28th deadline, and we're not in that category yet. We're not in both of those indicators being in the level that we would need them to be. And so that, you know, as much as we can predict what where the levels are going, you know, you have to be in those levels for 2 weeks before a change can be made for our recommendations.
All right, thank you.
Yeah, I mean, I also want to point out that, like, I think I think the timing of the DESE mandate is not ideal, because you're right. The day it expires is the day kids come back from school vacation. I think you know, it's up to the council members here, the school committee members here. We can always extend our own deadline and choose to implement this strategy we have at a later time. But this I think, you know, if you want to strike a balance between recognizing that masks can be a little bit annoying, but also recognizing that they work, and maybe even take into consideration the local risk, I think this is a pretty validated. It's a method that's already been used in other municipalities, as Lauren has said. So I think this is a great path forward. But obviously, it's up to your discretion.
Mrs. Rizzo.
Yes, I just want to thank you, Dr. Kong and Lauren Buck, for all the information they give us, so that we can make a decision on what's best for our schools and our students. And everything they offer is valuable to us. And as much as Jesse didn't come out with the perfect date, no matter what our numbers are, if our numbers are great in 2 weeks on the 28th, I would still like to see a possible 2-week extension because of vacation. And I had sent out this morning a new policy that, if the masks were coming off, things that we would still need to follow, such as the 5-day quarantine for a positive COVID test, masks required in all school health offices, and of course, the bus transportation. I also think some of this may need to be tweaked so that we can also incorporate how we will, what metrics we're going to use, such as the second diagram that they gave us. So I think we need to look at all the information that we got tonight, and then say thank you for their world of knowledge.
Thank you, Mrs. Rizzo.
Can I add just a couple of points,
Kelly.
mostly for the parents who I hope are listening right now? And the first is that it's not that the Department of Education or the commissioner is lifting a mask mandate on the 28th. What they're saying is we're not going to control it anymore. All of you districts and cities and towns, go decide for yourselves what is best for you and for your students. So that was the first point I wanted to make. And Mrs. Rizzo just brought this up, but we are still under a federal mandate to require all students on any school transportation to be masked at all times. So that will stay in place. And, just thinking about the logistics of even that and anticipating how we're going to implement, you don't have to wear a mask when your parent is dropping you off at school in the morning or during the day, but you need to have one to get on the bus to go home in the afternoon. If you're one of those kids that only takes the afternoon transportation, it's going to be a logistical lift, one that we will have to make, and we'll figure it out. But I do think that we need some time to survey parents and staff and say who is vaccinated and who's not, so that we can get a better determinant of those numbers at each school. And I do think that's something that we can do over the vacation week. We can get something out quickly before the end of this week and ask people to respond. But I think the idea that Mrs. Rizzo had, especially because we have our testing protocol in place on Mondays with the pool testing and on Thursdays with the at-home test kits, that that data would be really valuable to us to see whether or not our kids who may have traveled or been less vigilant with masking are bringing COVID into the schools. As you all know, we had a huge spike after the holiday break, and it was tenfold, and it was a challenge to manage, but we were able to do that. I just want to make sure that we don't have another situation like that going on and no one's masked, or very few people are masked. I worry about that. And the other point I'll highlight is one that Lauren brought up earlier, which is when you're not masked, your qualification as a close contact changes. So I just want everybody to know that if we're in a classroom and a student tests positive and they had been in that room and people weren't masked, there are going to be 5 or 6 kids going home as close contacts. And that's especially true at the elementary level, where fewer kids are vaccinated. And unfortunately, that comes to a nexus with a lot of parents who have to work and don't have childcare at home when those kids have to quarantine. So I just in part of the deliberations, I just want to make sure we're considering all of these things.
Thank you, Dr. Kelly. Mr. Kingston.
I'd like to suggest, I don't know if I'm out of order, but I'd like to suggest a school committee meeting for March 1st. That would give 2 more weeks out, and maybe if the Board of Health folks don't mind, come back and just give us the data for those 2 weeks. And at that point, maybe at that meeting, possibly a vote could be taken as far as what we want to do in the future. But I'd hate to wait till that much later in March. A lot of people do want to see this go away. But I think if we have a meeting on March 1st, and ask the Board of Health folks, even if they submitted a report, maybe if they can't make it, that's fine. Possibly we can make a decision that night and then move forward. I just don't think, I hate to see it put off another month, just because a lot of people are anxious about it. I know Rhode Island went to March 4th. I think they realized, the school vacation, which I'm concerned about. I'm concerned about the kids, of course, but I'm also concerned about staff. I know it's a challenge for Dr. Kelly to try to run a building when there's a lot of staff out, like we had after this Christmas break. So I'd really like to see a March 1st meeting scheduled and have 2 more weeks of data. And if things are trending in the right direction, then we can, it's a little better choice for us to make. Thank you.
Mr. Kingston, thank you. Ms. Gravellisi.
I don't disagree. That's a great idea. March 1st is actually a Tuesday, I believe, and I think the data comes out on a Wednesday or a Thursday, if I'm correct, Dr. Kong and Lauren. So
Yeah.
maybe after that data is retrieved on the Wednesday or Thursday of that week, if that makes more sense.
So that would be March 4th would be the Friday.
I'm just, is that more helpful to all of us with more current data? That's just my thought. The way the week.
Mr. Kingston.
Yeah, you'd have 2 more weeks of data though. You'd have this Thursday and you'd have the week, the following week when we're on when school's on vacation. So you'd have 2 more weeks of data to look at. That's what I meant. That way, that Tuesday, it's right after the 28th with, everybody's kind of expecting, because based on what the state did. I think you'd have 2 more weeks of data. That's what I was trying to say. That's why I brought up March 1st. It is a Tuesday, our normal meeting night, normal meeting day, and you'd have 2 more weeks of data to study. Just a thought.
And like they had told us before, the NAATS is over a 14-day period and not a 7-day period. So basically we'd be getting like 3 weeks. We have the week and then 2 more weeks. It'd be helpful. Doesn't mean we have to make a decision that night. And I know this is not going to be popular with most of the community, but I think right now, given that we do want to have some kind of policy in place, and hopefully that's optional. February 28th is right there. I think for the most part, many of us might think 2 weeks after school vacation would be using caution. So I don't mind seeing March 1st. Every time we're going to put it off 2 more days and it's 2 more days, parents want to know. It's parents and staff that want to know. The kids are great with it. I mean, for the most part, I mean, I have 2 3-year-old granddaughters that do not take their mask off once during school and always and point out who's not wearing a mask. So it's basically us as adults having anxiety with all this.
Any other members? Dr. Kelly?
I'm just wondering if there's like a middle of the road way to help parents understand or anticipate what we're thinking. And if there's some kind of, if there could be maybe some kind of a decision even tonight along the lines of, provided that we can collect the data and it matches what Dr. Kong and Lauren Buck have said, that we have the right percentages, and that assuming that our numbers are going to continue to trend in the right direction, that on March 14th, which would be 2 weeks after vacation, we plan to make the masks optional or something like that. If that would at least give parents something to understand where we're thinking about, as opposed to, even if we meet on March 1st, and we still can meet on March 1st, they at least understand where the direction is and not left tonight feeling like, well, now we don't know anything more than we knew yesterday.
I definitely agree with that, Dr. Kelly. We're going to put the second diagram they have. We'll include that in how we're going to measure this. And it has to be more flexible too, because it could be in 3 weeks with April vacation, the numbers start rising again, and we might have to go back to mask on. So we need to be as fluid as all this has been. So I think I would like to see a decision tonight. If our numbers are still not going in a downhill trajectory, I can understand changing that. But for right now, I would love to see an optional 2 weeks after school. That's my own opinion.
Yeah.
With the right number.
Ms. Milbury Ellis.
Yeah, I would agree with that wholeheartedly. I just think that the numbers are going down,
Mhm.
hospitalizations are going down, vaccination rates are going up. We're told that we're transitioning into this endemic and we need to learn how to live with, the remnants and live with this disease, basically. So, I mean, I think we just need to make choices that are good for our community. And I would agree that optional use of masks, allowing for the 2 weeks after the school break would be a reasonable plan of action.
Okay, so is there a motion or do we want to take a motion up at the regular meeting?
I anticipate that there are a number of folks who want to make public comment on this matter. And so maybe voting after that would make more sense.
Absolutely. On the floor,
Okay.
let them know.
All righty.
Speaking of, we're at 6:04 and we've only done one agenda item here. I know that Mr. Kingston has somebody who is going to speak about the vocational school. Is that right? Who's in the waiting room? And I don't know about all of the other items on the agenda. If anybody has a strategy for how do we just proceed here and be late to the other meeting?
Well, for now, why don't we thank Lauren Buck and Dr. Kong for
Good point.
their hour.
Sorry, I'm rushing
that they
too
have
much.
given. No, I mean, like I said, it's a world of education and information, and I know each and every one of us are truly appreciative,
Absolutely.
along with our school nurses. And
Thank you,
Dr.
guys. Thank you so
Galucci.
much.
Thank you.
Thank you.
Thank you.
I was also looking, as far as the field trip, that needs to be talked about. Can we get the consent calendar done first before, who's that gentleman that wants to speak to us?
It's Anthony Caggiano.
Mr.
He's the
Caggiano.
school
He's-
committee representative to the VOC.
Okay,
It's
So
part of
can
the
we-
consent calendar.
How does our
if that would come off the consent calendar?
How full is the other agenda?
Full.
Oh. Okay, we're wasting time, so why don't we just start going through everything as fast as
Okay.
possible?
So we'll go
Okay.
to the approval of minutes. Motion to approve.
Second.
Okay, roll call.
We don't need
Mrs.
to do that.
All
All
right,
right, I
roll call
thought-
comes
I thought-
later.
Oh, it's
I thought
on the
if we were,
consent.
I thought if we were on
Happy
Zoom, I'm sorry, I thought if we were on Zoom, we needed a roll call.
No, we do it, roll call at the regular agenda, at the regular school committee, because that's when we'll approve it, the consent calendar.
Okay. I was just under the impression that on Zoom, anything voted on had to be a roll call, but if not, I'm happy to move it along and say all in favor, say aye.
All right.
Aye.
All opposed, say nay. Ayes have it. That passes. We'll move on to warrants. Mr. Franti.
Thank you, Mr. Chairman. Matt, I have just a few questions. On page 1, number 21, Recall USA, copy of maintenance for $7,700. Is that just maintenance to the machine? Is it a new one? Is it part of the lease? Could you just explain it, please?
Sure, that's an annual maintenance contract for the district-wide copy machine. So this is the biggest copy machine you have ever seen. And it is the one that runs copies for the high school and print jobs throughout the district. So millions of copies and a high need for frequent maintenance, and it's got to be up and running. So that's a contract for that large machine.
Okay. My other question is on page 6. And I just noticed that the cleaning company got 2 checks. Did we miss a month? Or is that why they got paid twice?
No, the timing on that could easily be that a check got cut for the previous month on the 31st of that month and then the 1st of the following month. So there's no double payments. It's just reporting the exact date that the check got cut at the treasurer's office.
I'm all set. Thank you.
Anyone else have questions for the warrants? Seeing none, moving on to financial reports, we have none. No food service financials, and next is communications. And with us tonight, we have both school committee members.
Sorry, Stacy, sorry. There actually is a financial report. Mr. Cruz mentioned that was a typo on the agenda, but he does have a financial report he was going to do briefly.
Okay,
Sure.
Matt, I'm so sorry to leave you out.
No
You're
problem.
always welcome.
I can do this one in 90 seconds. So the governor's budget has come out. So we are now deep in the throes of creating the first version of our FY23 budget. And I just wanted everyone to see where the net school spending figure landed as far as the governor's budget is concerned. You can see we're on a little bit of a roller coaster. So I tracked the last 4 years increases, and we were up, and then down a little bit. So basically, because of some enrollment stuff and some of the way that they're counting low-income students, we are up in our net school spending requirement only by 6 million. That's about half of what it went up last year when the first year of Student Opportunity Act kicked in. So this is our starting point. We'll now be hustling with the city to establish the school's appropriation, working with Ways and Means. But the first number just to have in mind is we have a $6 million increase as far as the governor's budget goes for net school spending. And then we'll move forward from there. If that we had thought it could be 10 or 11, a second year of SOA, that's not what it is. Of course, we've had years where it's been 0 and we'd have to figure that out. So we're at the $6 million mark, and that's kind of like the gun hits, and now we can move forward in our process. So just wanted you to have that in hand before we get deeper in the budget process.
Thank you, Matt. Does anyone have something they might want to add, Michael?
Thank you. It's one quickie.
Sure.
Matt, the one thing, just looking at the numbers, where the projected numbers are got a decrease in minimal, how does the Chapter 70 money go up 4 or 5 million?
Yeah, sure. So student enrollment is one pronounced part of the calculus, but it's not the only one. So there's a number of things going into that formula about the city of Revere's economic realities and the way that SOA funding was going to be rolled out over 7, then 6 years. That's ensuring that we're not decreasing just because our student enrollment has been flat between these 2 years. On the DESE's website, you can dig into the foundation formula and see all of that. Naturally, if student enrollment is up dramatically, so is net school spending. But it's not the only factor that figures into that equation.
All right, thank you.
Okay.
Anyone else? Thank you, Matt, for your due diligence.
Sure.
The one other thing I'll add is that these figures, as we know historically, will come up a little bit in the final budget from the government. This is always the low spot. And then the House shoots high and the Senate finds the middle of the road.
Yep. Okay.
So moving on, thank you, Mr. Caggiano, for your patience. And we're interested to see what good things are going on over at the vocational. So it's all yours. But you're on mute. You're still muted.
I got you.
Ah,
Good evening, ladies and gentlemen of the school committee. Superintendent Kelly, Mayor Rigo, my name is Anthony Cadjan, I'm Northeast Regional School Committee for Revere. First, I'd like to thank you for putting us on the agenda. And I'd like to talk to you about a pilot program for Revere students only. When I first got elected, I started reviewing these pilot programs because of our waiting list with the Revere students. I believe if we have academics out of Revere and put the vocational part out of Wakefield, this will help decrease on the waiting list. We also have another version of it where we can do the pilot program totally out of Revere with the vocational, but I'm not sure how much space you may have. With that, I'll turn it over to Dave DeBarry. He's the superintendent of Northeast Regional. Dave, you on?
I'm putting him in now. I don't think,
Okay.
I didn't know that Dave was coming. I'm sorry.
Yep, him and Mr. O'Brien also.
Okay, sorry about that.
No problem.
Welcome, Superintendent DeBarry. Can you hear us?
Oh, yes. Thanks so much. Nice to
Okay,
see you.
always a pleasure.
Go ahead, Dave. I already spoke.
Oh, okay. So I don't know what you said, but if I repeat anything you say, I apologize. So I think we really just wanted to come in front of the committee tonight to see if Revere is interested in looking at some possible options for Revere students to receive a vocational education. Even if they aren't accepted to the regular full school program. So Anthony might have mentioned that Revere has our highest wait list, and that we really would love to collaborate with Revere and try to figure out a couple options, or maybe look at a couple pilot programs to give some Revere students some access to some vocational technical education, while at the same time allowing them to stay in Revere and be a Revere public school student. So what some of the vocational schools are doing right now is they're looking at two options. And the first, you may have heard of, it's called after dark programs. And that's where students would go to Revere High School and do all of their academics in the morning before lunch. And then they would be transported up to Northeast, and then they would attend a Northeast vocational program from 12 o'clock to 2:30. And that would be every day. And then they would be back in time at Revere High School to be part of any sports or clubs or anything else that they wish to do there. So that's something Essex Tech has really expanded, and we thought we might take a look at it. And Revere being our highest wait list, we thought that we would reach out to Revere first and see if there was any interest. The second program, which would again be a pilot program, would be for Northeast to collaborate with Revere and run some Chapter 74 programs in Revere. And I know most cities and towns are having challenges with space, but it would be something that would be in Revere. It would, the students would remain Revere High School students. However, they wouldn't have to go through the long, strict process of getting Chapter 74 approval, since Northeast already has it. So what we would do would share our expertise, share our resources, and work together to train instructors to work in Revere. But these are, again, things that the students would remain in Revere. Any money it would cost would come from new additional money for Chapter 74 students. So a Revere student would still be paid their Chapter 70, and that would go to Revere as well. But once they are considered Chapter 74 students because they're part of a program, then the state kicks in a little extra money, and Revere would just give that money to Northeast, and we would use it to fund the vocational part of the programs. So it's not anything that is developed yet. We just wanted to come in front of the committee to see if there was interest in exploring it. We would definitely take it slowly, and it would be in complete conjunction and collaboration with Superintendent Kelly and the Revere School Committee as well. So if anyone, has any questions or any thoughts about if this is something that you'd like to see us take a look at, we'd love to entertain it.
You're on mute,
To see if
Stace.
there was interest in exploring it, we would definitely take it slowly, and it would be in complete conjunction and collaboration with Superintendent Kelly and
So I think somebody's
the Revere School Committee.
Oh,
got a double.
Wow, that was. Anyone,
Yeah.
Has any questions? Sure.
Mr. O'Brien, would you like to add to
that you'd
the,
like to see us take a look? So I do have Mr. O'Brien on there.
I think Mr. O'Brien is on the YouTube as well, and so that's why we're getting the feedback.
Interest in exploring it. Wow, that's definitely. All right. Okay, Joe, are you back? Okay, so that's all right. So Mr. O'Brien would be the administrator that deals with special projects. He's our data coordinator, but he also runs our Saturday program that has a lot of different Revere students that attend. So that's part of the reason I asked him to come aboard and to help me answer questions that I might not have the answer for. So we can get started without him.
Aisha, do you have a question?
Yeah, how many Revere students are currently waitlisted? Or what's the average wait list?
So Revere students, I think, so we started out with 128 applicants from Revere. I believe we accepted about 66. Now, some of the students declined, not as many as in years past. And some of the students don't follow up because they attend other schools. So they might apply for Pope John, or actually Pope John's closed, but St. John's Prep, Northeast, a couple other schools, and choose one of the other options. Some decide to stay in Revere. They apply and then think about it and decide they're going to stay. So I would say usually students who want to be accepted that are probably around 40 per year.
Anyone have questions?
I'll just add that Dave and I had a conversation about this a couple of weeks ago,
Mhm.
and
So that's why we're getting.
and then, sorry, I totally just lost my train of thought with that. But we did have a conversation a couple weeks ago about maybe trying to start a pilot with just a handful of kids, like we were talking about maybe 10 or 12 kids, to see how that goes, and kind of a thing that would be a bit of a symbiotic relationship is we're hoping that if we relate a little bit more, then as we're designing the new high school, we can learn a lot from the VOC and their programs and understand better what programs our students really want to engage in, and that can help us with our pathways that we're establishing at the high school level. Dave mentioned that they did have some grant funding that would pay for the transportation. The one thing that I've been trying to navigate and figure out is the program is kind of designed for kids who are on like a 7-period schedule. So they actually still have 4 classes, and then their afternoon classes, they go up and engage in the vocational education. With us, that would be trickier because we're on the block schedule. So for, the kids would likely have to be taking 2 classes in Revere, and then 2 classes periods would be the time they're spending up at Northeast. And challenge with that is in the younger grades, the kids would not be meeting their required coursework So that's something that we would have to figure out. There are ways around it. We can do like semester length program or something like that and have a different cohort of kids who go up in the fall than go up in the spring. I think that for the children of Revere, it's something that we should look at because we should open every opportunity we can to them. So I'm always open to something like that. And I just think that we need to, if the school committee agrees that that's a good idea, then we can, really work with Dave and Joseph and Anthony and try to map out a true program.
Aisha?
I just want to say that this is like music to my ears. I love Dr. Kelly, hearing what you had to say about it. I absolutely agree. Vocational and trades are essential. They're essential to giving a well-versed education. They're essential to providing an alternative, avenue of success for children. They're essential to our community and I think to our country as a whole. I'm coming from a union household of workers, and I just think that this is an excellent opportunity that definitely needs to be explored. I can remember going to high school and kids leaving because they were going up to the Vogue to learn hairdressing or carpentry, or we had the mechanics actually in the high school at that time. Richie, you remember that? But I mean, these were great programs, and I think we're seeing the effects of not having these programs nationwide. So I am so enthusiastic to hear about this, to learn more, to kind of see a more developed kind of plan and how this would play out. And I just hope that we could really make it work. Sounds wonderful.
Mr. Kingston, did you have your hand up? You're muted.
I'm sorry, Susan goes first. She had her hand up before I did.
Oh, thank you, John. Such a gentleman.
You're the gentleman.
I just said the gentleman. My question was around transportation. Diane Kelly did answer that with the grant funding, and that will be totally paid with 100% grant funds. Is that correct, Dr. Kelly?
I'm going to defer to Dave, but I believe that's what he told me.
And
Yeah, so-
also adding to that question, sorry, Dave, like who would be transporting? Would it be Revere Public Schools? Like, I mean, how is that transportation going to be worked out? I know the Vogue, when they can pick up the kids during the school days, like they transport them. So I'm just curious about the logistics.
Right. So as far as things work right now, and as we know with DESE, things change on a weekly basis. But the way it stands right now is we're given regional transportation reimbursement from the state at about 75% each year. So Northeast would work with our bus company to provide transportation. We would be reimbursed 75% on average. And then, like Superintendent Kelly said, we have grant money that we're pretty much guaranteed over the next 2 years, as well as the Chapter 74 money that we would be receiving for each student would cover different costs like transportation, teachers, and all the different things that go with the program. So it's been working at, I think, 4 of the regional vocational schools have already up and running, and it seems like it's been a good fit. I have some sample MOUs that I can share with Superintendent Kelly as we go forward that really break down all the specific questions. There's a lot to do with special ed services, counseling services, who's going to cover what. But I think, based on the fact that a few schools have already paved the way for us, I think we can figure those things out pretty easily.
Thank you. It sounds great. Kids really do need this experience, and it's definitely a good path for them. Thank you.
You're welcome.
John, you're muted.
I think it's a great program. I think even if it's only a few kids to get started, I think it's very much worth the time and effort that it would take to do it. And I really hope School Committeeman Canjiano talked to me about it. And I said I'd be happy to put it on the agenda. And I really feel it's something that could turn into something really great for the kids in Revere. So I really hope we can try to move forward, even if it's a small number to get started and look at the model of other communities and what they're doing. I really think it could be helpful. Thank you.
Thanks. And if I can add, I'd love to, regardless of what happens, and Superintendent Kelly and I met literally the day before the COVID pandemic, and we were talking about programs that Northeast is not running that would be a great fit for Revere. So I think we'd love to be part of helping you develop new programs in your new high school. I think the days of, us competing with each other for, money and for MCAS scores are over. I think that we can collaborate on this. I'll give you an example. My son's in 8th grade. He's not in my district, and I'd love for him to stay with his friends and stay with the sports programs, but I know he needs to, get some vocational education. So he's going to be part of the Essex Tech After Dark program. And to me, it's the biggest win to be able to, have that option. Whereas other kids are looking, like I did when I left the Beachfront School, just looking to explore different avenues. And I was happy to jump on a bus and go to Wakefield, whereas my brother stayed in Revere High, and he's doing fabulous. I often borrow money from him.
That's because you got into education.
Yeah.
Superintendent DeBarry, I know in 2018, you started the Saturday program that seemed to be going really well. Is this something that you're looking to transition from the Saturday program to this?
Nope. We'd love to keep as many programs as like an a la carte program. Revere actually is our highest enrollment in our Saturday program, but it's a drop in the bucket. It's only 4 hours each Saturday for 4 months. And I think students would love more. And I think what we're hearing is, like in where I live, is they like Revere. They love their academic programs. They love their friends, their sports, but there is a little more that they'd like to take advantage of. And until the new school is built, maybe these are options for those students as well.
That's wonderful. Does anyone else maybe have a question to ask these gentlemen? If not, my suggestion is that Superintendent DeBarry and Superintendent Kelly work together, and maybe down the road they can come up with some kind of structure plan on how it's going to be worked on.
Great.
But we're all in agreement. This is wonderful for our students. So,
great.
Thank you.
Anyone questions? Okay, with that being said, gentlemen, I really appreciate your presentation, and we thank you. And you never know, we might be calling you with more questions.
Okay, thanks for having us.
Good night. Thanks, guys.
No,
And thanks
thank
for
you.
waiting so long.
Thank you. Bye-bye.
And that being said, Mayor Arrigo has returned, so I will give it back to him.
Thank you, Mrs. Rizzo. We will move on to an enrollment update.
It's in your packets.
Yeah.
If you have any questions, you can let me know.
Seeing none, we'll move on to personnel items. Any members have any questions or comments about the personnel items included in the packet? Okay, seeing none, we'll move on to school field trips.
We have acceptance of donations. And even though we don't have any, I was wondering for the future, if I know it's to accept it on our behalf, it's a certain amount, but, and we can talk more later, but I was hoping that we could start getting a running list of grants that we receive and donations that we receive, so that we have some general knowledge. If that could be possible. I'm
Sure.
sorry, Mr. Mayor, for sticking my 2 cents in.
No worries. I think, Dr. Kelly, that's something that we can produce going forward.
Oh, yeah, definitely. If it's okay, I'll change that agenda item to acceptance of donations, gifts, and grants.
That's great.
Sure.
Okay. We'll move back to the school field trips. Any members have any questions? Mrs. Rizzo?
I have a question because I noticed on all three of Mr. Miranda's, there is no lodging of where they may be staying, and it has not been signed off on the principal and the superintendent prior to coming to the school committee.
So we actually did sign them, and I know that because I physically signed them. And I believe that Robin made these copies as soon as she got them, so they could be into your packets. And what was your other question? There was no, what did you say on any of them?
The lodging, where they
Oh.
would be staying?
Yeah, so I think initially they're looking for permission before they book anything.
Okay.
And as is usual with these trips, they are somewhat dependent on how they progress at other competitions. So it might be the case that the team does not get invited to. I think that's highly unlikely. We have the most incredible robotics team, and I think they're going to be going on all of these trips. But I just want to say that that is a possibility. But I know that Mr. Miranda wanted to get the information to the school committee so that you could look at it and see if you had any questions or concerns before they proceeded with planning.
You know, we could still approve it or not approve it, but if he can get that information as he gets it, just so we have a heads up.
Yep.
I just looked at my copy. It's not signed. Did
Right.
pull up
I
the
think
wrong
that
thing?
Robin made these copies when he submitted them, put a set in my mailbox to sign. Do you know what I mean?
Okay.
And put these in your packets, or just took
So
the
you and-
electronic version, you know?
Okay, so you and Dr. Perella have already signed off.
We have both already signed off. Yep.
Okay, thank you.
Any other members?
I know I have, where it is on the consent calendar, I have no problem approving it. But I just wanted to make sure no one else had any questions or concerns.
Okay. So, Ms. Rizzo, are you making a motion to approve?
No, we'll approve the
Oh.
whole consent calendar on it, but I didn't know if anyone else had questions on it.
Okay.
Thank you.
Stacy, Robin did just text me and say the signed versions are in the school committee book to be signed off on, but because we're virtual. So the originals are in my office.
Nope, as long as you said it was done, I'm fine.
Yep.
We'll move on to transportation for the next year.
I think that maybe I can just be brief on this. And what I wanted to do was talk to the committee. As you know, Matt shared some information about the transportation budget last week when we met. And the transportation department is going to give a presentation on some of the things that they are planning in order to reduce cost of transportation. But it is still costing us significantly more than it used to. I know that some community members are not pleased that we have changed the policy to transporting only students who live a mile or more from their middle school, 2 miles or more from the high schools. So I wanted to put that on the agenda in case you wanted to revisit that. I honestly don't think that we can afford to make a change at this time. But we can also put that on a future agenda when there's more time to talk about it. And after the transportation department does their presentation tonight, that might be a more timely point to look at it.
Okay, I see nodding heads, so we'll plan for later.
Okay.
And we'll move to the last item on the, oh no, not the last item, sorry. The next item, Hill School parking lot issues.
So I just want to make you aware that we are having significant problems with the Hill parking lot. And what's happening is not that it is sinking, which it looks like the manholes and that are sinking in the parking lot. What's actually happening is the asphalt around them are being pushed up. And most of that's because of the volume of water underneath the ground there. Which has been freezing and unfreezing and freezing and unfreezing, and the asphalt is not finding its equilibrium after those frosts happen. So it looks like there are a bunch of sewer covers that are sinking when in fact it's the asphalt around it that's being lifted up. And I want to thank the Revere DPW who came by and helped us with that. They're going to do a quick fix over February vacation, just to make that a little bit more manageable. It's not the right time of year to do a full fix. So when the weather gets better, they're going to come back and help with that. But I just wanted to make you aware of that.
Miss Milbury Ellis.
We might want to put some type of signage indicating like unleveled, grounding or something to that effect to give some type of notice or warning rather of the condition.
Okay, good idea.
Mr. Franti.
Thank you, Mr. Chairman. Diane, are they gonna do the whole parking lot or just the area where they're having the problem?
I don't know the answer to that question.
Okay.
But I will ask.
Thank you.
Any other members? Seeing none, we'll move on to next item on the agenda, which is initial budget.
Which Matt already went over.
Okay, perfect. Any other miscellaneous items from committee members?
Motion to
none.
adjourn?
Motion to adjourn by Mrs. Rizzo. Is there a second?
Second.
Mr. Kingston?
Second.
All right.
Roll
We will
call.
adjourn. Now we take a roll
Roll
call.
Mrs.
Thank you,
Bronson Rizzo,
Yes.
Mr. Ferranti,
Yes.
Miss Gravellisi,
Yes.
Mr. Kingston,
Yes.
Mrs. Milbury Ellis,
Yes.
Miss Ty, Mayor Arrigo.
Yes.
Okay,
Okay, meeting's adjourned.
3-minute recess?
That would be great. Yeah, I need a 3-minute and then I'll start the other one.
Okay, thanks.